the Royal North Shore Operating Theatre Donning and Doffing PPE procedure for COVID patients. It's been adapted from the CEC guidelines in consultation with our local infection control unit.
Like all practice modifications for patients that have contracted or suspected to have contracted COVID-19, these guidelines are dynamic and evolving. If you feel any errors have been made or have any feedback or questions in general, please contact us via any of the following channels. Correct wearing of PPE is imperative in our theatre complex. We aim to perform all operations for patients with COVID-19 or suspected of having COVID-19 in operating theatres 17 and 18. Donning should take place in the anteroom. The Department of Anaesthesia has developed cognitive aids to assist with the sequence of donning, which have been printed and placed on the walls of the anteroom. It is very important that a buddy system should be in place when donning PPE. We were unable to capture the donning sequence in the anteroom for this video as it was engaged with clinical activities at the time of shooting. The order of donning that we have established in the following sequence is designed to specifically assist clinicians to doff safely at the end of the case. First, alcohol-based hand rub should be applied for 20 seconds. Then the N95 mask should be applied. One strap at the crown of the head, one strap at the base of the neck. Gently compress the nose piece across the bridge of your nose by pressing down with fingers until the fit is snug. Then finally, perform a fit check by breathing in and out, ensuring that the mask collapses on inspiration and fills on expiration, without a significant air leak around the edges. A surgical bouffant should then be worn, and this should be placed over the ears. Next, a surgical mask with visor should be placed over the N95 mask. If you are about to perform a sterile procedure like a central line or block, this is the time to perform a surgical hand wash and perform the remainder of the steps in a sterile fashion. The next step is to naturally don a long-sleeved gown. We recommend that each gown is velcroed and tied at the back to ensure that your back is not exposed. If you are not performing a sterile procedure, you are allowed to wrap and tie the gown yourself. Next, please put on 2 pairs of gloves. Ensure that the first pair of gloves sits high over the white cuff of the gown. In this video, both clinicians have chosen to wear sterile gloves to achieve this. Finally, take your time to check each other before making contact with the patient. Your PPE will need to stay on for the duration of the case, and it is extremely important to buddy check your colleagues throughout the duration of the case and build this into your workflow. Please note, we have a whole separate video on how to minimize exposure to aerosol particles when performing aerosol generating procedures, such as intubation and extubation. Prior to leaving the theatre, you will need to doff your PPE safely. You should be particularly careful when doffing, as this is where you are most likely to contaminate yourself. Doffing will generally happen after you have recovered your patient in the theatre, typically after 30 minutes, and are ready to transfer them to the ward. First, remove your outer gloves. Next, remove your face shield and visor, being careful not to touch the front, and putting it straight into the bin. The next step is to remove your gowns. Due to multiple complaints of gowns ripping when clinicians have tried to remove them, we actually recommend untying your buddy's gown before removing your own. Being conscious to remove the gown from the back without touching the front, and then rolling it off to place in the bin, taking your gloves off as the sleeves come off your arm. Next, perform hand hygiene for 20 seconds. You will now need to remove your surgical bouffant cap, again being careful not to touch the front and putting it straight into the bin. Perform hand hygiene for another 20 seconds. At this point, you can leave the operating theatre. Once outside, you can remove your N95, being careful again not to touch the front, and to unhook your thumbs under the elastic bands, taking the mask and the surgical cap off your head at the same time. Perform hand hygiene once again for 20 seconds, and then begin to don clean droplet PPE consisting of a surgical cap, surgical mask, gloves, and a thumbs-up gown. Once you have transported your patient to the theatre exit or ICU, you will need to doff this PPE and go to the change rooms to shower and change into new scrubs. We hope you found this video to be helpful and would like to thank you for listening. We'd also like to leave you with 3 take-home points. 1. Always address well-being prior to donning. This should include hydration, nutrition, and using the toilet. 2. Use the cognitive aids and a buddy check to guide the processes. And 3. Always be meticulous about closed-loop communication whilst PPE is on. This video is all about safety. And to close, it's only befitting to say a genuine thank you to all of you for looking out for one another during this challenging time, both physically and emotionally. It's truly, truly appreciated. Thank you.